São Paulo. I'm a plastic surgeon, full member of the National Society of Aesthetic Plastic Surgeon. Our research was done in University Federal, São Paulo, and I'm very happy to be here to share my experience using the combination of rhytidoplasty and fractional CO2 laser therapy of treatment of facial aging, and show how it's possible and safety to address patients' satisfaction. The main theme of this Congress is tracking and tackling its consequence. We think it's the key point of the treatment to make a detailed and precise diagnostic and a detailed and precise planning of the surgeon to avoid terrible consequences, to avoid unsatisfaction results. Watching this picture, we can see most of the different mechanisms of the aging process. Very skin damages in this people, gravity lines, active lines, and loss of volume. That's the reason we think it's important to combine a procedure and to do a lot of ancillary procedures, also more than of only the rhytidoplasty. First, tracking, very beautiful woman on her late 50s with a phototype 3 and photodamaged skin and an aligned face with sagging eyelids, sagging eyebrows, small church of deformity, nasolabial folds, and small jaws. And what we did, we planned with toxin botulinum type A on forehead and terciliar eyebrow crease. We also do it prior to the service 7 days before. After that, we performed a rhytidoplasty, a precapillary incision. We planned the incision of a small portion of lateral orbicular muscle. We included a blepharoplasty with a small platism plicature, a small amount of hyaluronic filling, and in final of the surgery, we include luminous application, ablation CO2 on the non-undermining skin, and CO2 laser fractional on the undermining skin. But otherwise, the regular cares of all surgeries, we think it's important to follow specific cares to avoid complications in all surgeries of the face. We can say that in pre-operative care, 13 days before, we control blood pressure using a atenolol oral to decrease the bites of the heart bite. And we take care about the skin using ascorbic, tretinoin, hydroquinone, and sunscreen at least 30 days before surgery. In the post-operative care, we keep controlling blood pressure control with atenolol. We keep a control with infection against infection using cephalosporin and acyclovir. And skin, in the first 15 days, we applicate a sunflower, vitamin A and AI, linoleic acid oil, and a solution of mometasone ointment. Soon after 16th day to the 45th day, we start using hydroquinone and keep using mometasone. This is the incision, like the zeta match incision in the precapillary temporal part of the face. This patient are under local anesthesia and sedation. This after undermine, large undermine, we are directly seeing the muscle and taking off a little bit of the lateral portion of the orbicular. The procedure finished. As you see, we're trying to reduce active lines around the crow's feet. This is our after the hemostasis. We applicate we do application of SMAS and platysma with 2 or 3 stitches with a monoline of 4-0. After the application, we have finished the application. After the application, we do in the blepharoplasty, and we see in the SUF fat, the SUF and the fat bags. We only take off the excess of the fat. We don't take all the fat. When we do undermining myo flap, cutaneous flap. After the large undermine, we do a correction of the tear trough and taking off this excess of the SUF. We are fixing and doing a flowers cantopexy. Finish the procedure. And on the crease between the eyebrows, we keep injecting the hyaluronic acid with a small amount. And the finished procedure. This is a small video showing the incision lined this is the undermine with scissor. We do a large undermine, carefully undermine, but very large. We go releasing the attachments below the chin to elevate pull up the flap. This is the large undermine. And we use an electronic device, very little, very carefully, and doing these stitches to pull up the SMAS and platysma. After that, we pull up the flap and fix it before the retroauricular portion and taking off the excess of skin. This is we fixing in the precapillary portion and taking off the excess of skin in preauricular. Our flap is very not stretched to avoid a bad scar. On the other side, we are doing the undermining and fixing this mass platysma and taking off the excess of skin and fixing behind the auricular, fixing the precapillary. We finish the suture. We use Jackson Pratt drainage for 1 day. And now we are finishing the blepharoplasty at the same procedure, injecting a hyaluronic filling, superior and inferior lip. And we also, in this case, we increase the size of the chin with thick hyaluronic filling. With small, we do often in parts and steps. After finishing the procedure, you can notice the prepared skin with retinoic acid. We start laser application. We say that's very important to prepare the skin, because if the skin is prepared, you avoid terrible complications. This is the application of the laser, the luminous total ablation on the not undermined. We use a total ablation form, but with care. To address the lipstick wrinkles, and we change the energy to a fractional to address the undermined skin. Okay. After that, we take off the skin with a gas with solution, physiological solution. This is the finished procedure, and this is the pre-operator on the left, the central, in the 2 weeks after surgery and the 90 days after surgery. you cannot see a better shape and of the skin, a better shape of the mandibular jawline, and the elevation of the sagging eyelids and sagging eyebrows. This is another case. The same case, in this case, it calls attention the coarse wrinkle lips and chin, neck, and jaws. You can see very deep wrinkles around the mouth, we call lipstick lines. And we use the same technique. And this is the final result. You can see a lateral oblique view and the lateral view. Another challenging case, a very friend of mine, a mother, a friend of mine, and she asked me her a lot of different kind of aging process, and the plan was very big, and we included a blepharoplasty and smooth tear trough and cantopexy. We made all the things ancillary procedure with the other than rhytidoplasty capillary, using luminous ablation and hyaluronic filling in steps. This is the result 15 days after. This is the result, the better appearance of the skin, elevation of the jawline and the median 30, inferior 30 face, the superior face elevated also, a good correction around the eyes, better shape around the mouth, and still keeping with wrinkles, but she's very, very happy with the result. There's another overweight people, calls attention, double chin and hypomentonism. And we planned the same, but we performed a submental liposuction, otherwise a rhytidoplasty, and we inject a little bit of hyaluronic acid, and this is after 15 days. And we can also see still the scar in the precapilar, but it's initial of the reeling. And this is after 3 months. A better shape of the chin, a better shape of the mid face and the lower face. A man case, his best focus was to correct strong corrugators, deep interciliary fold and tear trough deformity. We planned botulinum toxin, rhytidoplasty, and also this is the final result, and correction of the tear trough deformity. And he has his hair dyed. He's very happy with the final result. Another no Caucasian case, phototype 4. Very difficult to handle because of the phototype, but we include a very long list of plan, and that include a rhinoplasty with tip support, and we put some graft from the septum to elevate the tip. And if this final result, the best appearance of the skin, the elevation of the tip of the nose, the increase of measures of the lip, superior and inferior, the size of the mantle a little bit greater. She's smiling and a very young fool. Lateral view. This is the last case. The first I showed before. I think it's one of the most challenged cases because of a very different mechanism of aging. We included all these procedures, and we want you to say that hyaluronic filling was done in steps. and include an aesthetic dentistry. And this is the final result: an elevation of the sagging eyelids and sagging eyebrows, and correction of the tear trough, and elevation of the nose. Reduce the length of the superior lip surgically. And this is, she's smiling, and we clarifying the dentistry. We send her to a dentistry, and there's a better appearance of the skin after using the laser, and the close photographs to show how the laser can help us to correct the coarse line around the lips. And this is the distribution of the result. We done this ancillary procedures in about 80 patients, and we had I can see 4 hematomes, expansive hematomes, and 1 partial necrosis of the flaps, 1 bacterial impetigo infection, 1 herpetic infection, 1 hypertrophic scar, and 1 spot hyperchromia. And we can say that these complications are not bigger than if we use this technique in conjunction. If we use the rhytidoplasty alone, the complications rate is the same. We can conclude that the proper indication, the selection, and the appropriate use of the various ancillary procedures improve the aesthetic results. The pre, the while, and the post-operative care avoid complications. This is very important. You have to take care very carefully from about the patient. And the concomitant treatment of the photo-damaged skin at the same recovery and get best results. The advance of this tissue bioengineering improves safety and satisfaction. Thanks a lot.
Thank you, Dr. Marcio, for your great presentation. And from Omics International, I give the certification of your scientific work. Okay, please come remain here in the desk. So now.